My name is Dr. Umama Adil. I'm a pulmonary and critical care physician at Hamilton Specialty Care, Vitruvian Health. My husband and I were both physicians. I have one son. He's 4 years old, and he keeps us on our toes. I grew up in Pakistan. My entire family has moved now to the United States. My husband grew up here. He was here. I was back in my hometown, home country, Pakistan. But we met through family during medical school when I came here for my rotations. Both my parents are physicians. My mom's OBGYN, my dad's a pediatrician. So it was almost a given that all of us are going to end up being physicians. I have 3 sisters and all 3 are physicians. So it was just like inherited. I think what really helped me was seeing how rewarding it is. My parents actually built their own hospital and had their own practice, and I realized that's what motivated me. I'm originally from Pakistan, so after high school I went to medical school back there. I went to Al University. And then after that, I came to the United States for my training. I did residency in Hennepin County Medical Center in Minneapolis, Minnesota. And then after internal medicine, I did 1 year of a hospitalist at the VA in Oklahoma City, and then went on to do Pulmonary and Critical Care Fellowship in University of Oklahoma in Oklahoma City. Since then, basically after training, I've been in Quincy, Illinois, which is a very small town, 2 hours west of St. Louis, in Blessing Hospital, and that's where I was working as a pulmonary and critical care physician. One of my very first clinical rotations in my intern year was ICU, and I absolutely loved the acuity. I really liked the fast-paced nature. I really liked just taking care of sick patients. That just like was a calling. ICU is a calling, I always say. That's not something you can do just on the fly. It has to be something that you just like you work and you love it. And that's kind of what I felt like about the ICU. What I really liked about pulmonary is the fact that I get to still have longitudinal relationship with my patients, and it really complements what I do in the ICU as well. So it was the best of both worlds. So you get that longitudinal relationship with your patients in the clinic setting with pulmonary, and then you can also do advanced procedures, and then in the ICU you get the sick patients and the high acuity as well. So for me, I felt like it was the best of both worlds, and that's what really appealed to me. You're not just in clinic, you're not just in the hospital, you're doing everything. I do think that to me will always be the most rewarding thing. Even in the ICU, these are intimate moments and very like serious moments with the family, and you just realize just how important of a part you're playing as a physician. So yeah, I would always say it's the relationships that I have with my patients in both ICU and pulmonary. When I feel like a patient felt that he or she was heard, and I took care of them in a way that they felt heard and taken care of, I think that to me is the most rewarding thing. I'm very easy to get along with, and I want the patients to know that I will listen to them. I'd be happy to help them through it, walk them through it, so they would know that there's no judgment in the room when they're with me. I do want patients to know that I will always look out for them and make sure that they're heard. I'll always be an advocate for them, even if it's to a different specialist. Hamilton has such a great work culture, and the fact that it's independently owned, I think, is what really sets it apart, and what helps the culture, develop this culture of being autonomous, being able to make decisions at a local level. I think that really sets Hamilton apart.